Hi, my name is Lopez. I work in the field of behavioral health, mental health. I have been working in the field for over 21 years. Before we had an integrated program, it was very difficult. 95% of the case management team were mental health specialists, but we only had one substance abuse specialist, as if this was something taboo. We couldn't talk about it. We provided counseling, of course, for substance abuse, but we really never connected these two very difficult challenges in one session.
Hi, everybody. Now that we've checked in and reviewed the group rules,
now we work on groups that promote the philosophy and the technique of COD, co-occurring disorders. We focus mainly on a wonderful practice known as the Integrated Dual Disorder Treatment, IDDT. You have two facilitators, typically a mental health specialist and a substance abuse specialist, working together. So what things have worked for you guys? The practice is composed in stages. First, the stage of engagement. Secondly, the stage of persuasion. Third, the stage of active treatment. And fourth, the stage of recovery. That's what we do in the group. The stage of engagement is when individuals are in pre-contemplation. They're not ready to talk about this. Some might be, but they have a tremendous amount of ambivalence. The counselors engage the individual in many different topics, but to slowly bring the person to talking about their substance abuse challenges and how these affect mental health challenges. Persuasion, as we do it in group, is a wonderful opportunity for people to sit down and actually start talking about these topics. The individual is very involved in the discussion. They support each other. Facilitators are really there to introduce the topic, ask some questions, and motivate conversation. Active treatment is very interesting because at this point, individuals are already engaged in either serious harm reduction or actual abstinence. People come in, and each person will do a quick, brief introduction. Based on those introductions, the facilitator will pick maybe one or two topics, and the discussion happens for the next 45 minutes to an hour. By the time a person reaches the recovery stage, people pretty much are recommended to either facilitate groups or maybe go into the community and join a self-help group like AA, NA, or Double Trouble. These individuals have been doing IDDT for a while, and they have become now ambassadors of it.
you might want to try one of the ones that your peers are using. How does that sound?
We brought in evidence-based practices in 2003. We brought our first group in 2006. In 2007, we seriously started working with IDDT. And I hate to sound too mystical about it, but the accomplishments were magical, you know. Things like incidents began to decrease. Hospitalizations began to decrease. Eventually, consumers began to independently run their own groups. So don't walk away from this. Try it, talk to people that have experience running groups, and yourself, when you get a chance, sit in the groups and go through the dynamics. You're gonna love it.